Hi there, everyone. Happy Friday. Today is Friday, January 22nd. I'm not sure if we mentioned this yesterday, but yesterday, the 21st of January, marked the 1 year anniversary of CDC announcing that they had confirmed the first case of COVID-19 in a U.S. resident. It was a resident of Washington. And I think that, for most of us, we're still working as hard as we have been all year, but I think it's important just to maybe recognize that, we've been in the pandemic, COVID-19 pandemic game for a full year now. Worldwide, there are nearly 98 million cases, and in the U.S., almost 25 million cases of COVID-19 just in the first year since it was first introduced and recognized here. In Alabama, this morning, they're reporting on 436,087 cases of COVID-19. So, nearly 450,000 cases of COVID-19 identified in Alabama just in the first year of it being in the United States. Deaths also at an all-time high. More than 2 million people have died with COVID-19 worldwide. In the U.S., that's just over 411,000, and in Alabama, around 6,500. Hold on a second. All right. Sorry, having a few technical difficulties here. So, even though the first case in the U.S. was announced on the 21st of January, Mobile County did not begin seeing cases detected here until March. So our first case was on March 19th. Today, we're reporting the cumulative number of COVID-19 cases as 31,348. 249 were added yesterday. There have been 567 people who have died with COVID-19 infections. The cumulative number of COVID hospitalized, 3,908. That's an increase of 19 since yesterday. And we, look at the number of Mobile and other residents that are patients from Mobile and other locations who are hospitalized on any given day with COVID-19. And right now that stands at 245. That was a decrease of 5 from the day before. We've talked about the fact that we're now well past the 14-day mark. I think this marks the 21st day past the New Year's holiday. So hopefully we have seen all of the primary infections that occurred during gatherings during Christmas and New Year. We have seen a slight reduction in the number of cases and the number of people hospitalized, although those counts are still at historic levels. So we need to make sure that we're hyper vigilant with wearing a mask, washing our hands, staying at home if we're sick or if we're exposed, to try to keep, get those numbers of infections down so that we can try to, to relieve the burden off our hospitals. Just to remind you, if you have COVID, you're at home for 10 days. If you're exposed to COVID, you're home preferably for 14, but no less than 10 as long as you're asymptomatic. So a good rule is that if you have COVID or if you've been exposed to COVID, you need to be at home for 10 days. That's the only way that we're going to be able to slow the accelerated phase of the pandemic that we're in now. Because the other thing that, will help us drive down transmission and disease is the vaccination. So just want to just speak briefly on just a reminder. We've put out some more information, but just to remind you that there is a critical shortage of COVID-19 vaccine right now. Mobile County Health Department is currently providing second doses. So our second doses have been made available to us for the first round, and we are providing those second doses. The only and next opportunity to receive a first dose will be on Wednesday, January the 27th at the Mobile Cruise Terminal. That's at 201 Water Street. From 11 to 3 p.m., we'll make vaccine available, first dose vaccine, on a first come, first served basis. So we are not taking appointments for any vaccine, any vaccination, whether it be first dose or second dose. And all vaccine clinics going forward will be no appointment, and doses will be administered on a first come, first served basis until further notice. But it's going to be a while before we get to where we have enough vaccine that it can just be part of sort of our normal business. So you also still have to be eligible to receive the vaccine in order to come to the cruise terminal. So unless you meet these criteria, do not come to the cruise terminal. Right now, to be eligible, you have to be 75 or older, a healthcare worker, a first responder, or a hospital-based, have a hospital-based job that puts you at high risk for exposure. So think about custodial contractors that work at hospitals, laboratorians that may come in contact with, patient specimens that may have COVID, some mortuary workers, some clergy that deliver last rites, those sorts of things. So again, we have not moved on to vaccinate any other groups in the 1B category. We're vaccinating 1A healthcare workers and hospital-based workers, and then first responders and 75 and older. That is still the requirement through at least next week. And if we hear anything differently, we will let you know. We hear that some people are sneaking in even at some of the hospital locations and getting vaccinated, but there has been no official expansion of the eligibility requirements from the state health department. So we're still trying to do our best to stay in line with what the rest of the state is doing. Remember that the most current information will be available on a recording by calling 251-410-MCHD, or you can visit our website at www.mchd.org. When we realized that we could open a first dose clinic next week, we did that, and it went on our website first because that's the easiest for us to change. So please keep checking back there for new updates. So even if you are eligible, we want to make sure that you've not received any other vaccine in the last 2 weeks. We want to make sure you haven't been treated with plasma or convalescent plasma or antibodies in the past 90 days. There are some other things that would cause you to defer vaccination, but the main thing is that you must meet that eligibility requirement, and you need to be able to document that. So bring your driver's license or your work badge or other credentials. And again, this is a rapidly changing environment. We understand there is frustration, particularly by people who were told that they had an appointment by the 855 toll-free number, that it was made on a day that we don't have vaccine scheduled. It's caused a lot of concern for people who thought that they had an appointment to get vaccine. We will not be honoring any appointments. So please, if you thought you had an appointment, come to the cruise terminal on Wednesday, and please be patient with us as we work to sort of clean up some of the misinformation that was provided over that 855 number. And just to remind you that the current Safer at Home order has been extended unchanged through March 5th. So those, wearing a facial covering orders, those sorts of things are still in place and will be in place through March 5th. All right, so over to a couple of questions. So there were some reports, I think, on social media and around that other groups had been included in the eligibility at this time. Things like, educators and congregate settings and detention centers, those sorts of things. But that is untrue. We have not gotten guidance from the state health department to extend beyond current eligibility. which are healthcare workers, first responders, people who work in a healthcare setting who are at high risk healthcare setting who are at a high risk of exposure, and people who are 71 and older. When we receive information that other groups will become eligible, we will put that information on our website and on our recorded message at 410-MCHD. All right, another thing, someone reporting that law enforcement conducted a survey to see how many officers would take the vaccine, and from the survey about 45% say that they would be willing to take the survey, and someone wants to know what my reaction is. I would like to see the participation rate much higher because this is a very safe and very effective vaccine against preventing disease, but I think 45% being willing in the beginning will take it, and hopefully they will get vaccinated and compel those who are reluctant to then take the vaccine after the safety and efficacy of the vaccine is demonstrated among their colleagues. At the health department, we are seeing participation rates much higher than we have seen for influenza. We're really happy about that. So again, I know lots of people are in the wait and watch category. They want to see what happens with maybe some of their colleagues first. But I think that as we, over time, as there is more and more demonstration that the vaccine will prevent you, most of us, from getting disease, and that it likely will reduce transmission, I think you'll see more and more people want to receive the vaccine. I got my second dose day before yesterday, and I'm doing pretty well so far. So there's an example of one person. Okay, then also a question about someone was out and about in the community and saw families with their kids with no masks, that sort of thing. Oh, this was someone who had some people at their house whose children were not wearing masks. So I just wanted to read it. They were asking for guidance on that. So according to the CDC, no child under the age of 2 should wear a mask, but the state health order that was just extended said any child 6 years of age or younger, or any child who has not yet entered the second grade, is exempt from wearing a face covering. So if you're 6 or younger, or if you're less than first grade, then the facial covering does not apply necessarily, though it's still a good idea. But any child 6 over the age of 6 should wear a face covering according to the state health order. Okay. I think there's another question that's come through.
Are we testing for the UK or South African variant in Alabama?
All right. So the question is Alabama testing for any of the variants that have been identified around the world? Particularly the question was around the UK and the South American variant. South African. Okay. The answer is yes. All states are participating with the Centers for Disease Control in a sequencing project to try to identify not just the variants that have been detected in other parts of the world, but also any new variants that might evolve in the United States. So the last public report I saw was that the B.1.1.7 variant, the UK variant, had been identified in at least 10 states in the United States. To my knowledge, the state health laboratory here has begun participating in that program. I don't know how many sequences have come from Alabama yet, but yes, we are participating in that program, both the state public health laboratory, and then I think CDC has also engaged large commercial laboratories to submit specimens in that very large sequencing effort to try to detect variants as they are occurring in the environment. Anything else? All right. I think that's it for today. Hope everyone has a lovely weekend, and we'll see you on Monday and talk more about the COVID-19 pandemic and vaccination efforts in Mobile County. Have a good weekend, everyone.